Welcome to Speaking of Pets.
We're the Novotny sisters from Cleveland, Ohio.
I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist.
And I'm not. I'm Janet Novotny-King, the doctor's sister, podcast co-host, pet owner, rescuer, and lover.
We're here to provide pet owners with science-based information to help them be the best pet parents they can be.
Here's today's episode, created just for you and your pets.
Hey everyone, welcome to the show today. We have one of my favorite people, and I don't want to fan gush too much because, Janet, I know you're embarrassed when I fan gush, okay? First, Dr. Breitschwert, now Dr. Greco. And Dr. Deborah Greco is a veterinary internal medicine specialist with her primary area of interest is endocrinology, which, Janet, we will talk to you about what that is. Yep. She also has her PhD in pharmacology, and she's a musician, which we just found out.
We just learned.
Yes. So welcome, Dr. Greco. It's such an honor. I'm so glad you're joining us today. Again, another fan gush moment, but I never miss a lecture or a webinar of yours because I always find something I can use to help my patients or my own pets. So thanks for doing the show today.
Thank you so much. And I'm so glad that you brought up Ed Breitschwert because I worked with him at LSU. He was my mentor. And he's one of my favorites.
Really? You lucky devil.
Ed, yeah, I mean, one of the reasons that I am an internal medicine specialist is because of Ed. So.
Oh, I believe that. You know, our mentors, my mentor was, I had two, Dr. Breen and Dr. Chuck Parshall, who was a veterinary ophthalmologist.
Yeah.
And sadly, Dr. Parshall is no longer with us. And I can't tell you, when you lose a mentor, it hits you hard.
Oh, yeah.
It really does.
Yeah, it does.
But Dr. Breitschwert, you know, we had a really good interview with him, and we loosened him up.
Oh,
so
yeah.
We got him talking about his farm.
Yeah. That is, he can be that way, but I met him in Louisiana. He was a little bit more wild then. Because that's what,
really?
That's what Louisiana does to you.
Yeah, I bet it does.
Yeah, it was when he was at LSU.
Well, Janet, I know you want to know when we say endocrine disease. So if you wouldn't mind, Dr. Greco, what is an endocrine disease?
Like veterinary 101.
So I usually use this analogy for the immune system, but I'm going to use it for the endocrine system because I think it applies as well. It's like the Twitter of the body. So the endocrine organs are not connected per se by blood vessels or veins or nerves to the organs that they affect. They produce minute amounts of hormones, which are produced in the glands, such as the thyroid gland or the pituitary gland or the pancreas, the islets of Langerhans. And then they have an action that's distant from the organ. So we measure the effect by being able to measure the minute levels of hormones in the blood. So it's like a Twitter messaging system.
Wow. I never thought of it that way before, but that's an interesting way to look at it. And what's interesting to me is the teeny amounts of the hormones that those glands make such a big difference if they're out of whack.
Yes, because we're dealing with such minute shifts in metabolism and such minute shifts here and there, constantly adjusting it all day long. And I think some people, when they measure hormones, they make the mistake of thinking they're a static system, but they are completely fluid and always changing and always being perturbed by other things. You can tell I'm Italian because I do this.
Oh,
Sicilian.
We're not Italian.
Yeah, we're Slovak and we do that.
Yeah.
So what's a list of some endocrine? What is it?
Endocrine, Janet.
Oh, yes.
Diseases.
So most of these are ones you're well familiar with. So the most classic example would be diabetes mellitus, or as we say in the South, sugar diabetes, right?
Yeah. Hey, they
Yeah,
say that in
sugar
Cleveland too.
diabetes, yeah.
She has sugar.
Um, and
Yeah.
then another very common one in people is hypothyroidism. And then we also
Yeah.
see hyperthyroidism. We see calcium disorders like hyperparathyroidism, or so you always have low or high, right? And then two other very common diseases, Cushing's disease, which is excessive cortisol in the blood, or Addison's disease, which is insufficient cortisol in the blood. And JFK suffered from Addison's
Oh,
disease,
wow.
which
That's right. He did.
very
Yeah.
cool thing about Addison's is at the turn of the century, the number one cause of Addison's was tuberculosis, adrenal
Really?
destruction by
So,
tubercular
th-
nodules.
oh, so the adrenals were destroyed by the mycobacterium.
Yeah. Whereas
Really?
now it's an
Oh,
autoimmune disease.
yeah. Interesting.
So what are the most common of these endocrine diseases amongst
Yeah.
pets? And I'm thinking probably more in
No,
dogs than cats.
actually, it's just different in dogs and cats. So cats are much more likely
Oh,
to develop hyperthyroidism. And in fact, that's the most common endocrine disease in cats, followed by diabetes mellitus. And that's a
been
difference
there. Yeah.
also between cats and dogs, is that cats develop what we call type 2 or adult onset diabetes, which is what most Americans have. And dogs actually develop two different forms of diabetes. One is type 1, which is autoimmune in nature, and the other is secondary to pancreatic disease, which is technically called type 3
Mm,
diabetes.
mm.
Hmm.
And then in dogs, hypothyroidism, particularly in purebred dogs, has to be the number one endocrine disease that I see, followed by Cushing's disease and diabetes mellitus type 1 or 3.
Are these diseases in young dogs, middle-aged dogs, old dogs, cats,
Well,
age-wise?
yes, it
Do they
depends.
differentiate?
If the endocrine diseases that are caused by autoimmune disorders are generally young to middle age. So hypothyroidism and
Mm,
Addison's disease would be in
okay.
Hmm.
young middle-aged dogs. However, in the case of well, diabetes is one where you can see it in young dogs, but I think it's more often in middle-aged dogs. And then the older
Mhm.
dogs tend to develop Cushing's disease. That's probably the most common one in older dogs. And in cats, hyperthyroidism is usually older cats, cats older than 8 years of age.
Older cat.
Uh-huh.
And so if you have a cat that has an overactive thyroid, hyper, how do they look? Like, how would I know if I was a cat
How
owner?
does it
Yeah.
present?
Well,
How does it
the most
present?
common thing is that your cat starts to lose weight, and generally, because most of our cats are overweight to begin with, people are like, "Oh, he's acting like a kitten now. He's running all around the house because he's nutso because his thyroid level is through the roof, and he's losing weight, and I didn't even have to cut back on his food. But he is drinking a lot of water, and he's peeing outside the litter box, and so
Yep.
he sprayed on my house."
Mm.
Right. So it's
Hmm.
sometimes they don't bring them in because they think, oh, it's my cat got a second lease on life. And other ones, they bring them in for
Yeah.
things like peeing outside the box.
Yeah. Because it influences them.
Yes.
You know
Yes,
what
it
I'm saying? The
So,
human.
influences them.
Right.
okay, so I'm a pet owner. I have two cats and a
Right.
dog. So I'm suggesting this. I guess the best thing to do is to go for your annual vet appointment where they do the blood work and all that to see if
Yes,
anything's changed,
especially
right?
for
Would that be a
subtle
good indicator?
diseases like Addison's disease and hypothyroidism, where they come on gradually, and then all of a sudden, when they have no hormones, right, that's usually when the owner brings them in. But we can, this is
Uh,
especially in dermatology, you're my counterpart for hypothyroidism is the
Yes.
most common endocrine disease of pets. And I will say that over and over, and my fellow endocrinologists argue with me. And I go, well, I guess, you say you haven't seen them, but they've seen you.
Ah, that's true.
right? And
That's
and so
true.
my pet peeve about hypothyroidism is you really need to see somebody who has a high index of suspicion. So your dermatologist, if your dog is having skin problems,
Yeah.
they're going to put hypothyroidism way up on the list to rule out because they can solve the problem easily. And that's the reason why, a lot of people miss that disease is they're not looking for it. They really aren't.
Well, and I remember in one of your lectures, you mentioned that by the time they're diagnosed with it, it's been going on a while.
Oh, it's several years usually. Yeah.
Oh.
Hmm.
Yeah, yeah,
Yeah.
yeah, yeah.
And
I would love a hypothyroid patient, a dog with low thyroid, because it explains a lot. And as I told Janet, your thyroid gland controls everything about you. How your poop consistency, how fast you move around, your vision, everything, your heart rate. And when I have a hypothyroid dog, and you pretty much know as soon as you walk in the room, Dr. Greco, don't
oh
you
yeah.
agree?
Hmm.
And you correct them. I mean, and my other thing is you usually can correct them within 60 days. I don't like to correct them too quickly.
Right.
I figure this thing has taken a long time to start. So I kind of don't do the textbook dose. I put them on a dose and then I recheck their level and I can always go up. I don't want someone to have heart palpitations because I've quickly corrected something that's been going on for years.
That's a really good point. And in your case, as a dermatologist, you have more of a luxury to do that. Sometimes I have to reverse it quickly because they also have concurrent diabetes or lipid
Oh, true.
abnormalities that are causing trouble. So
Yeah.
I tend to do the opposite, but that's because I'm an internal medicine specialist. And so I sometimes have to rescue dogs pretty quickly, and then I don't care if the hair comes back. I mean, I care, but
Yeah.
it can be very
Yeah.
subtle, those changes. So what I try to do is diagnose them as early as possible, and we actually have some new tools that you may not know about in diagnosing a couple of these
Oh, good.
diseases. One is I use the point of care endocrine system from Trueforma. So we have 3 machines
Okay.
in our offices, and I can give people an answer that day. And it works by, it's a different method than IDEX or Antec or radioimmunoassay. It's actually a molecular weight shift. So, and that's directly tied to the concentration of the hormone. But for example, you can do endogenous ACTH right there in your office. You don't have to do special handling. You just pull the sample and plasma tube
Wow.
and run it. You can
Right,
do
right, right.
cortisol, thyroid, endogenous TSH, free T4. Um, and there's some other CPL and
That's
things like
wonderful.
that, and progesterone too.
Yeah.
You can do progesterone for, if you have any of those cases that you might want to do that on. So um, that has been a game changer for me. And cost wise, it's less expensive than sending it to the lab.
Mm-hmm. Mm-hmm.
So,
Well, I just think it's
So is
what's
that all
that?
from blood work? Is that all from
Yes.
blood work,
Uh-huh.
those
Yeah.
tests?
Yeah. In general,
I'm
with
assuming. Okay.
endocrinology, you're
Because that was one
measuring
of my questions. What
the concentration of hormone in the blood. And we're talking, so 10 to
yeah.
the minus 6 micrograms, micrograms per deciliter, or 10 to the minus 9 picograms per deciliter, right? So these are tiny,
wow.
tiny amounts of
Tiny amount.
hormones, right? Like just a smidge, a soupçon, as they would say. Yeah, of hormone. Hmm.
And I think,
But hormones rule the world.
yeah,
When something is off,
Yes.
I mean, you feel it. And even like having had children, I'll never forget your hormones change like the minute after you have that baby and
Yeah.
everything is like
Yeah, because your
mm-hmm.
like
progesterone starts to
it
drop.
changes
Yeah.
everything.
Hmm. Right.
Yeah, it's
Oh, well,
terrifying.
you
It's
talked about
really
having a
scary.
baby. Actually, the worst is menopause. You know,
Yeah, that's
Oh, I
I knew you
amen.
guys were going to say that. I
Amen.
was like, I have 3 other people that understand what I'm saying. But
Dr. Greco, I now know why old ladies wear tank
yeah.
tops to Christmas
Oh,
parties.
yes, they're
Because they're
hot. Yeah,
because
all
they're
the
oh,
hot.
yeah.
time. Yeah.
They're hot the whole time. It's December, it's 20 below, and they're
Well,
like in a
and
sparkly
having
thing.
said that, I was looking up something and I can't remember, but it came upon a group of people, mostly women, and it was talking about, for example, hypothyroidism and how
Hmm.
miserable these women were and they couldn't get the right answer and they've been to endocrinologists. Your heart goes out to people because aren't they
Hmm.
being tested properly or treated properly or next,
It's
if it,
Yep.
here's the drug, next patient. It's really criminal. My heart went out to these women. And I have to say, in veterinary medicine, I think we're a little more cognizant of testing for endocrine diseases than I see what's going on in, at least in Cleveland, Ohio, human medicine.
yeah.
Well, wait a minute. And the
Yeah.
humans can speak
Oh
Yeah,
yeah.
right.
and
Well,
tell
and
you what's wrong with them.
your best bet actually is to talk to your gynecologist because they're
I
used to
think
measuring
I agree
hormones and
with that.
stuff. So I found this out
Yeah.
because I had thyroid cancer when I was in vet school. So Mike Lappin and I are both
Oh, wow.
survivors of papillary
Oh,
carcinoma of the
geez.
thyroid, right? So
I
we
did
share
not
our
know he
thyroid
had it.
medication when we're speaking together. But it's
Oh, my
I could
goodness.
not find a thyroidologist. I couldn't find one in New York City. I could not find one in Los Angeles greater area. And because all the endocrinologists are treating diabetes. And
True.
so
Oh,
you're
well, yeah,
actually going to get
because it's
your
prevalent.
best for women, go to your gynecologist to balance because they're also balancing progesterone and estrogen and testosterone. And those will affect
That's true. Yeah.
the thyroid concentration.
And I think women speak up
Yes.
about their symptoms.
Well,
True.
the
True.
symptom, I will tell you, I also had breast cancer in 2005 and then again in 2024, and mine is hormone driven, right? And so I'm on an estrogen blocker,
Wow.
and
Mm-hmm.
the symptom, I will tell you that you would not even guess is due to menopause, is pain in your shoulder, pain in your hip,
Oh,
it's because it affects
wow.
the tendons and the soft tissue, the
Uh-huh.
capsule of the hip. And nobody explained this to me. And I had to like do a bunch of reading about it. And also
Yeah.
carpal tunnel. Sometimes, well, with me, because of my hypothyroidism, I can
Yep.
sometimes get, but I go in to my quote thyroidologist who was a resident from China and we got over the language thing. And I said to her, "You keep reducing my dose of thyroid." And I said, "But I've been at an extremely high dose for most of my life because they didn't want my cancer to come back. So you try to suppress the TSH, right?"
Mm-hmm.
And she's like, "Yes, but your bones are at risk and this and that and the other." I go, "Okay, here's the deal. I will sacrifice the bones for
Right.
comfort, okay? And to feel alive and not feel
Ah,
dead because you've reduced my dose by 50%. Yeah, no, that's not happening." And so then I fired her.
Wow.
no,
I go,
I just don't understand that going by the book and not looking at the patient
mm-hmm,
and considering their feelings. I'll never forget, and we'll get back on the subject again, but I'll never forget, Janet. I took mother to the cardiologist who happened to be a friend of mine when I was a pharmacist. Okay. I'm not going to say his name.
Right.
And so before he came in, the person, I don't know if she was a nurse or assistant or what, came in like this. This is the laptop. Hello, Mrs. Novotny. How are you
Oh,
doing?
please. Oh,
And
hello.
wait, and I'm
I've
counting
been
down
there.
3, 2, 1. Are you going to turn around and look at my mother?
yeah.
It's all about what went in that laptop, and no hands on. She could have had
Oh no,
lymphoma,
I
and nobody would
exactly.
have
I
known.
have you ever had a physical since I was a kid? I don't think I've ever had
Yes.
a physical
Okay,
from a
Yes.
quick
doctor.
listen here,
Yeah.
and then and I had a benign thyroid nodule, and so every time I go, I'd say, "Would you check and see that?" Yeah, yeah. Oh, it's not there. Swallow. Okay, yeah, yeah. It's like,
Okay, here's what I see. The laptop is like
Yeah.
protective gear
yeah,
Yeah.
that's
in front of
right.
them. Because I went to a new doctor. I got
Oh
to tell
wait,
this
Janet
story.
had Lyme and went to 800 doctors before
Oh,
she was
like my
diagnosed.
horse. Yeah.
So
She's in
I had
Connecticut.
Lyme and
She's in
Bartonella
Connecticut.
and polymyalgia rheumatica, blah, blah, blah. So anyway, so I go to this new internist because mine had retired, and he was great because he diagnosed the Lyme and all that. He was fabulous. So I go to this new one, and I'm in the room in the little smock, and I'm on my iPhone, and I'm like, I did the New York Times crossword puzzle. I did Wordle. I did
Oh, I
four
don't care that I
puzzles.
have to wait.
Oh, wait, I'm sorry. If I'm the 9 o'clock appointment, the first one in the
Oh,
morning. So I'm sitting there now. I go, oh my God, it's
Whoa.
9:50. Like, so I go to open the door in the smock, and here's the new doctor with the laptop like this.
well, maybe he's reading
And
your
she goes,
history.
yes. I don't know what she was doing. She goes, yes. And I said, well, I was just wondering if
Oh boy.
and so she comes in. I don't even know her name, how to pronounce it to this day. I said, I'm Janet King. And she just went, mm-hmm.
So you didn't even
I
know.
don't even know
Oh,
her.
wow.
And it's a German name.
Yeah.
I don't know how to
Hmm.
pronounce it. And I sat there. It was the most horrible, horrible
See, this
experience.
is
I
why I
can't
love
even.
veterinary medicine because if we're not
Oh,
on the floor with the dog, we're accepting the dozen of donuts that they brought
Yeah.
us. You know what I mean?
We get the
It's
best
such
swag.
down to earth. Yeah, the vet swag. I love that.
Yeah.
We've all had that arm, you know where, and we've all had these fingers, you know where, and nobody has an ego. And if they've got an ego, they better get out right now.
Yeah.
so Dr. Greco, I was working in New York. I was in the fashion business for years, and I remember talking to Alice. You were in vet school, and I remember saying, "Oh, we got a new line in today, and this is going to be big in the fall." Da 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 da. And I go, "And how was your day?" She goes, "Well, I
Of a cow's
had my
butt.
arm up the rear of a cow, and while it was there, it had some gas." And I'm
Oh
like,
no.
"Oh
But
my
wait, that's why
gosh!"
they call it freckles.
Yeah.
Here,
A
here
little
I
vet
was worried
humor.
about what color was going to be in for fall, and she's got her arm up a
Yeah.
Yeah,
No,
cow's
yeah,
it's
she
ass.
was
different.
she was
It's a whole
asking you
different
if
world.
they were in the new color for fall, fecal green.
Yeah, if it was beige, I'd be good.
Yeah.
But one more thing before we get back on topic. But Dr. Greco, tell Dr. Greco, Janet, who diagnosed your Lyme.
My sister, the
Yeah.
veterinarian, and my
That sounds
chiropractor.
exactly right.
Mhm.
I'll never forget. Andrew's working on me, and I said, God, I have this pain. It's
And
going
she
from
like does
shoulder girdle
Pilates
to
every day. She's like a crazy person.
like I was uber. I was at that point. I was doing boot camp. I was uber fit, and he goes, Janet, I'm telling you, I think you have migratory body pain. I think you have Lyme disease, and
Yeah.
we're going to test you. And he's the one I did the blood, whatever lab. It was not the one your friend
No,
sent.
it
The other
wasn't
one you went
Galaxy.
to.
It was I
It was
something. IGenics, yeah.
Igenics. And sure
Yeah.
enough,
Yeah.
blow up, there it
Yeah.
was.
Anyway,
And Alice was reading a book at the time, and that's how you
oh,
knew
I
it.
have it right here. It's called Chronic by Dr. Phillips. He
Yep,
had Lyme,
that's how
and
you
his
knew
dad
it.
had Lyme.
Yep.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's Golf Ball Retrieval Service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
But let's talk Cushing's disease
Sure.
because
Yeah, I want to know, okay, how do I suspect my dog has
okay.
Cushing's disease? Because a lot of my friends' dogs have it and they
Yeah.
medicate.
Cushing's disease is one of those diseases
You
that's
don't?
really tricky. And I'm not sure that it's the same disease that we saw when we first became veterinarians. I think the
Interesting.
variant we see now is, especially the dermatologists see, is very benign. But as an internal medicine specialist, I used to see animals with end stage Cushing's that, I mean, even the paper by Mark Peterson says they only live 2 years. even with treatment.
That's true, Dr. Greco. Yeah, I would agree with
But
that. It's a different
dermatologists,
variant. Yes.
Wayne Rosenkrantz is my classmate, right? And Wayne and I have
Yeah.
this discussion all
Oh,
the
I
time
didn't know
about
that. Yeah.
Cushing's. Yeah, I have 3 derm people in my
Yeah.
class, Ann Evans and
Who else did you have? Just
um,
curious.
who was
Wait,
married. She
where
was
did you
You
hear that
did.
degree?
Barb Atley is the 3rd derm person. She was married to the other
Oh,
dermatologist at NC State.
was it Terry
Thierry,
Olivery?
yeah,
Terry Olivery?
she's his
Yes.
ex-wife, yeah. But she's a dermatologist as
Yes.
well.
Okay.
But we've talked about Cushing's a lot, and he's like, yeah,
Yeah.
that's not my experience. My experience is they live decades, right? I mean, that they live. I put them on
Yeah.
trilostane, and they do fine. And I go,
Huh.
Yeah.
well, I've had, and I have to say, still, I see the ones that go south. But for whatever reason, maybe
Oh.
because I'm a tertiary, referral. A lot of times they've already been to a internist, and then they come to me for endocrinology part of it. But
Yeah.
yeah,
Yeah.
I just had
Interesting.
one that decompensated after anesthesia, and it was a huge tumor in the pituitary tumor. And
I've
What's
only had one of those.
decompensated? Wait, what's
decompensated is
decompensated?
when the dog, after anesthesia, didn't recover well and started showing neurologic signs like
Oh,
circling and
oh
blindness and things
wow.
like that.
Yeah.
I
Oh
only had
gosh.
one of those cases in 35 years, and it was a miniature poodle
That's what this
who
was.
was under control and then got neuro.
Yep.
Yeah.
Mhm. Yeah.
It was a poodle
And
too.
Janet,
Wow.
because it's usually a little growth in their pituitary gland.
Hmm.
And somehow it gets to be what we call a space
Oh,
occupying lesion and then presses on all the important stuff. And
Becomes a brain tumor,
oh.
yeah.
basically. But most of the time, they have
Yeah.
just what we call a microadenoma, like a few millimeters. This is true in people as well. That, that's a great story about Harvey Cushing. He, the
Oh, yeah. Who it's named
who's
for.
the Cushing's disease is named for. He was both a pathologist and a surgeon. How handy is that? And
Oh.
and when he identified Cushing's
Huh.
disease, he told the people that were affected that he would do their surgery for free if he could have their brain after they died. So when they opened his lab in like after 100 years, which was just recently, so I think he was in the 20s or 30s, right? Well, so it must have been 20s, yeah.
Yeah.
They just opened his lab, and
Yeah.
they found all these heads in jars. Like he didn't, and he was a
Oh,
pathologist. I
Like
don't know why he had to
Halloween.
take the head out or the brain out of but
right.
I,
Oh, my
it was
Lord.
like a Frankenstein thing.
Mm.
That's
But
actually kind of cool.
um, Harvey Cushing, yeah, that particular type of Cushing's in dogs, I'm not sure that's exactly what we're seeing now. I think we're seeing
Right.
something similar to what
Hmm.
happens to ferrets when you neuter them at a very young age. I think it has to do with
Mm-hmm.
neutering at a young
Mm-hmm.
age, but that would be hard to prove. But I see a much more
Yeah,
benign
you're right.
form of Cushing's now.
So for all these endocrine diseases, what is the treatment? I'm
Well,
assuming
it
medication,
depends.
maybe
Is it
surgery?
excess hormone or insufficient hormone? So if it's insufficient hormone, the
Right.
treatment is easy. You take an estrogen supplement, you take a, cortisol supplement, you take a thyroid supplement,
Thyroid.
take a
Yeah.
calcium or vitamin D supplement.
Hmm.
For the excess hyperthyroidism, Cushing's disease, we generally rely on medication that interferes with the synthesis of the hormone. That's generally how we treat it. We don't directly treat
Hmm.
the disease.
So my pet's being treated for this. Is there any case where it becomes an emergency once they're on the medicine? Like what would I
Yes.
look for
So
while they're on a
we'll use
medication?
Cushing's as an example because if you overtreat a Cushingoid dog, you get an Addisonian dog, which is actually sometimes how I treat them. If I think they have a really
Huh.
bad disease
Mm-hmm.
or they have a tumor of their adrenal gland or something, I will chemically um, produce an adrenalectomy. So I will give a high enough
Mm-hmm.
dose to kill off all the adrenal tissue, including the malignant tissue. and then supplement. And for parathyroid tumors, that's what we do. We remove them. Thyroid tumors, we remove them and then supplement them back if we need to.
Mm-hmm.
Now,
It's just
my
interesting.
my last Golden, who's since passed away, she was 15 and a half. She had a thyroid tumor.
Yeah.
And it was kind of like here.
Right.
It wasn't like right here,
Mm-hmm.
but it wasn't producing any hormone.
That
Um,
very
but
common. Yeah.
I remember, yeah, and my friend Heidi Ward, who is a veterinary internal medicine person, said, "I don't know, Al. I think it's thyroid." So anyway, apparently it's very vascular because when the surgeon took it out,
Right.
they're very blood
That's why
filled.
we
Is that
don't do
true?
thyroid biopsies. Right. So,
Oh,
so
interesting.
the whole thing about hypothyroidism was really difficult because we didn't have good hormone assays back in the 80s and 90s and stuff. And we couldn't use thyroid biopsy like they do in people because it's so vascular in the dog that you just have, it's like a bleeding mess after you biopsy it.
Wow, I believe it. Yeah.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's golf ball retrieval service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
So are these medications costly?
Yes and no. Some of them are inexpensive. Methimazole for hyperthyroidism is relatively inexpensive. But I don't like to keep them on that drug long term. I usually recommend that they actually undergo I-131 treatment, which is radioactive treatment of the tumor, so that you actually do kill off the tissue that's cancerous. The trilostane, that's probably maybe the most expensive one I can think of, right? Because thyroid hormone is pretty cheap, and
Yeah.
I would say trilostane.
What about for Addison?
Addison's DOCP can be expensive.
Has that price come down?
Yeah, it has. When they switched from
Oh, good.
the original one to Zycortal, the price came down quite a bit.
Okay.
And the Florinef is less expensive
good.
too, because there's a generic available.
So do I have to go, would my everyday vet be able to treat one of these, or do I need to go
Well,
to a
Well, first
specialist?
diagnose. That can be the problem.
That's it. Yeah,
Right, yeah.
usually they're sent to me for diagnosis. Treatment is relatively straightforward in most cases. Except for maybe Cushing's, because you have to keep if you have to keep balancing them and then trying to figure things out. Diabetics can be tricky too. Yeah, I just had one present with a hypoglycemic seizure, and she'd been stable at 4 units for like several years, and then all of a sudden, and then I realized what happened. The dog actually lost weight, and my dose of thyroid was too much. And so that, like I said, if you're balancing several things at once, then and she became polycythemic and all of these different things. And then finally we realized,
Wow.
oh, you know what? We just missed it on the dose, because the last time I adjusted the dose, she was one weight, and then a month later she was another weight from probably protein losing nephropathy is what caused the weight loss. But
Wow.
yeah.
I was always nervous about that. We had Smudge was our diabetic cat, and I was always nervous that there was going to be a seizure because I'd never experienced one. She never did, but we always were like, you'd give her the insulin, we'd be
Right,
like,
yeah.
wait
But
for it,
the
you
thing
know?
about cats is that, and we're going to talk about cats, right? In a little bit, yeah.
Yeah, oh,
The thing
yeah.
about
I
cats
hope
is
so. Oh no, we don't do
that
cats.
they
Just kidding.
they tolerate hypoglycemia very well because they're designed to eat only protein. They are not designed to eat carbohydrate at all. And so as a result, their normal
Cool.
blood glucose runs between 50 and 60 milligrams per deciliter when they're eating a high protein diet or a diet in the wild, like mice and reptiles and birds and stuff like that. So they tolerate
In
hypoglycemia
my
very,
case,
very
flying
well. And
squirrels, by the way.
you won't see a seizure in a cat.
Interesting.
Wow. I've never thought about that. And I've never seen, never, knock on wood, seen a seizure in a cat.
Not from
Wow.
hypoglycemia, no. Yeah.
No, no, you're right.
Yeah.
You're right, come to think of it. Yeah.
So let's
Yeah.
talk about cats. What kind of endocrine diseases
Well,
are there?
cats,
For
the
Diabetes.
cats.
most common
Yeah.
is hyperthyroidism. And that's an interesting story because I know some people don't agree with me about this, but I think the preponderance of evidence suggests that hyperthyroidism is an epidemic that was man-made, and in particular from compounds called PD. Let's see if I can say this. Poly
PFAS. Is it
polybromated
PFAS?
diethyl esters, PBDs. Okay, these
Uh-huh.
are flame retardants, and they are present
Mm-hmm.
on upholstery,
Oh,
carpeting, all these things. And what they
fabrics.
found is that, turns out children also suffer from a similar condition of hyperthyroidism. And
Yep.
so the investigators originally out of Indiana, it was or MD, of course they were humans, but MDs that were studying hyperthyroidism in children. And they said, oh, there's this disease in cats. We'll measure these compounds that we think is causing the problem in the children. We'll measure them in cats. And they found it was elevated in the serum of cats that were hyperthyroid. But more importantly, it was found in their in their hair, and because cats lick their hair, right? So and then they ingest it
Right.
because they're licking their hair when they're grooming.
Yep.
So it's like, why don't small dogs get the same exposure, right? Well, small dogs don't, except poodles, don't lick their fur, right, and ingest
Right.
the
Yeah.
compounds. So I think that is the most likely cause of hyperthyroidism. It's
Mm-hmm.
what we call an environmental toxin. Also, I warn people that I really seriously think that the epidemics of breast cancer and prostate cancer in humans are related to endocrine disruptors in our environment, and in particular, laundry detergents and
Mm-hmm.
fragrances. So those plug-in things, those dryer
Yeah.
sheets, those things, none of them are present in my house.
The pods. Yep.
It's funny you said that. I just read on Medical Page today a cancer specialist, a woman oncologist, said she will never have Tide or the laundry sheets in her
Yep.
house, and a couple of other things as well. And when you think about getting back to cats, I don't ever recall seeing hyperthyroidism in an outdoor
No,
cat.
they did a study on feral cats. It doesn't occur. It's a disease of
Right,
indoor
because they're
cats
not
only. Yes, you're correct. Hmm.
right.
Okay, so wait, mine are indoor
Yeah.
outdoor. Is that a
Uh-huh.
good
That's
thing?
less exposure. And
They're
then
mostly
wooden
outdoor.
floors, not
Yeah.
wall-to-wall carpeting or tile floors, things like that. And
Wood
none of
floor.
those plug-in things either, those Glade things. Oh,
Oh,
one of my
Yeah,
clients,
no.
he goes, I cleaned up my
Well,
house
those start
and then I put
fire.
lavender essential oil out. And I go, that's highly toxic to
oh, I
cats. Do
can't stand
not
it.
do that. It's
Oh,
like, if you don't like the smell of
yeah,
cats, don't have
yeah.
cats.
Yeah. Well, it's
My kids
really,
don't
it's
smell.
like the cats are like the canaries in the coal
They
mine.
are.
The disease is
Oh,
showing up in them, and then we see the same thing going on in us, and we didn't learn from the cats.
Exactly.
So sad.
Hmm.
wow.
Mm.
Okay, I'm going to toss my dryer sheets, even though
Well,
they're
the
unscented.
unscented
Yeah,
ones
but
are
there's still
probably
something in there.
okay. Those are probably okay. It's for some reason related to the scent.
Well, we just
Yeah.
get static here. The static's
I
like really
can't
bad in the
stand that
winter.
scent. You know what? One time I bought Liquid Tide. One time I bought the
Oh,
wrong one and it had a scent to it. I like all night I was like, oh my God, I can't stand
Yeah.
it. Yeah, on the sheets.
well, our older sister Penny cannot even walk
No, I
down the
can't
No,
aisle
either.
with
that's true.
those.
Yeah,
That's
because I
true.
get
She
respiratory
literally like
issues from
flares
it.
up.
Yeah. Hmm.
Yes.
Yeah.
Oh,
Hey, one day I was in a Pilates class and the woman next to me must have bathed in something. And I was like the whole
oh.
class going
I'd
like,
be
It gives
"Go
me a
to
choking.
water."
headache
It was
Yeah.
thinking about
horrible.
it.
Yeah.
It was
Yeah.
horrible. And you're stuck. Like you
Hmm.
can't leave,
Mm,
Oh my
Yep.
God.
mm. So cats with hyperthyroidism, cats also diabetes.
Hmm.
Yep.
Now dogs are Cushing's, diabetes, hypothyroid. Um,
Yep.
what did we? Oh, what about hyperparathyroidism? The parathyroid, which controls your calcium.
Yeah, it's pretty rare. I'll see a case a
Yeah.
year pretty much,
Cats.
and it's generally
Oh,
treated
that's
surgically, and I
yeah.
just handle the vitamin D part of it, for whoever I work with, whatever surgeon I'm working with. But
I think it's more common in humans because my brother-in-law, Jerry Bauer, who's passed away now, he actually was sent home from Vietnam because of
oh yeah,
hyperparathyroidism, and it was causing kidney problems.
yes, hmm,
Oh, I didn't know
yeah,
that part.
Hmm.
yeah,
Huh.
it sure can.
Wow. Well, this has been just so informative. I'm wondering what other questions our viewers might have. They're concerns
Well,
about their pets.
I was gonna
Important
talk
is
about
getting your.
hydration, and in
Oh
particular
yeah,
in
let's
regard
yeah,
to
Oh,
cats.
especially as they get older. Yeah,
And
yeah,
yeah.
generally, dogs we don't worry as much about because dogs are really good drinkers, and that's why we're able to feed them things
yeah,
like dry food and stuff because they just make up for their water deficit. But having worked
Yeah.
for Purina for 15 years, and I talked and talked and talked until I was blue in the face about this to them. And I think maybe by the end of my 15 years, I got through to them. And that is that the dry food that you feed the cats is just not natural. And it's 15, no, 10% moisture. Their diet in the wild is 70 to 80% moisture. And I have a theory that they overeat to get their water requirement, that
mm-hmm,
they're
mm-hmm.
overeating the
I can
dry
Huh.
see that.
food because they're trying to meet their water requirements. So you'd have to actually eat 8 times the amount of food, 10% versus 80%, right? Or at least 75% more,
Wow.
7 times more food in order to get the same amount of water. And the other thing is that we have to talk about all
Huh.
the barriers there are to cats being able to drink, the way that their eyes are forward like this.
Mhm.
Imagine you
Yeah.
had to drink like this, right? You wouldn't be able to see where the water level was. So that's why cats walk up and they put their paw in the water. They're testing to see where the level is. They're
Yes.
not playing in the water. They're not
Oh.
doing any of the things we ascribe that behavior to. They're checking where the water level is. So, and
Yeah.
sometimes they stick their
Yeah.
head in and go,
Huh.
because they judged it wrong,
Yes.
right? But
I've seen that.
so, and
Yeah.
then people put the water bowls in like a corner, which is terrible because then the cat feels like he's trapped there. He can't escape that way. He's in a defensive position anyway, where he's
Yeah.
drinking, and people or other animals could attack him from the back. So there's a behavioral issue,
Wow.
there's a visual issue. And then finally, they can only, with each lap of water, they can only bring up 3/100ths of a teaspoon with each lap.
Oh my
So we
God.
actually calculated how many laps of water it would take for a cat to meet 100 mils per day, which is the average what they need, right, of water. If the cat's eating wet food, they only have to do 130 laps of water. If they're eating dry food, they have to do almost
Okay.
600.
Oh, Lord.
So,
Whoa.
so what we
Wow.
have in our cats, particularly our elderly cats, we have an animal that's been chronically dehydrated, particularly if they're eating dry food throughout their life. It's higher in carbohydrate. That was my theory about why they develop diabetes. And we're starting to reverse that trend
Mm-hmm.
now that people don't feed exclusively dry food. But kidney disease, and it's been shown in people, and there are some studies in cats as well, that chronically being dehydrated increases a hormone called ADH. And chronic vasopressin, that's the other name of that hormone, chronic vasopressin
Mm-hmm.
excess causes the kidneys to continue to try to concentrate urine in a very high level and hypertrophy, and it changes the tubules and all of this. And it could be the cause of chronic renal disease in cats. We almost always see them develop by the time they're 10 or 12 years of age. So hydration is particularly important. And before I left, I did all the communications with a product that Brian Zangi, who sadly has passed away, but he developed the product called Hydrocare, and they're now
Yeah.
starting to sell it over the counter in like pet stores and stuff. They have
Oh, good.
equivalent one, and what they did with that product is they also increased the viscosity of it. So like, when we used to feed cats cream and stuff, no, I don't recommend doing that, but they were able to drink more because the viscosity was higher. So they're able to get more volume of fluid per lap. So the Hydrocare has increased viscosity, and then it has what are called idiogenic osmoles, or osmoles that go away or are metabolized. They're proteins. So it pulls water in as well. So it's a hydration
that's
supplement similar to, you've seen the stuff you put in your water that has electrolytes and stuff in it.
Yeah.
It's similar to
Yeah.
that. And that's been a really big.
I wish they would market that more, because I don't think people realize how important hydration is, especially in cats.
Exactly.
They're just dumping the food out and that's it. And then here's a 12-year-old cat that's starting in chronic renal failure, and you try to reverse stuff that you can't reverse.
Right.
Yeah.
Exactly.
So canned food with more moisture would ultimately be better.
Yes.
Correct?
And that's, I had always thought that I would recommend canned food because it's very low in carbohydrate in general.
Oh, right.
But now I think that there was a component of hydration to that as well. That's why they did better.
Well, Mike, I got to change
Yeah.
some things
I
around
know.
here.
I feel badly because cats are kind of like second-class citizens. Cat medicine is now, I think, evolving more than when we first started our careers.
yeah.
Cats were just, okay, we're focusing on dogs. Yeah, well, cats have that too, but oh, whatever. Yeah,
Well, can I say something? I think it's because of a cat's attitude.
I don't think so.
Well, it's funny
they're
because I'd
kinda
rather
like,
see a cat come in than a big nasty dog, to tell you the truth.
Oh, any day. Same here,
A
sister.
big wet mouth dog. No. I'll go with the kitty cat. And because I saw so many cats when I lived in New York, and I see a lot now because I work at Animal Samaritans, which is there's a shelter associated. So I see a lot of the cats that come in. I think my client list is 50-50 now, and it used to be 80% dogs.
Yeah.
oh, wow.
And I have to tell you, I love treating allergy in the cat, atopy,
Yeah.
inhalant allergy, if you will. I think they do fabulously on immunotherapy. And Janet will tell you, I'll be showing an owner how we do our allergy shots once a week,
Yeah.
and to keep it simple. And some owners would be a little nervous. Do I have to give my cat a shot? What are you talking about? And I'd give the shot, and we'd be talking, and they'd say, well, when are you going to give the shot? I'm like, well, I did that 10 minutes ago.
Yeah.
But I've had 80-year-old arthritic women cat owners that did
Sure.
fabulously giving their cat a shot once a week. And
Well, better than
I
giving a
think they do
pill.
better on immunotherapy than dogs.
It's much easier to
Yeah.
give a
Oh,
cat a
Janet,
shot
you're
than
going to
give
give
it a
us
pill.
that.
Right.
Amen.
Mhm.
And with
Amen.
immunotherapy, you have a chance to actually cure this disease.
Exactly.
You don't with any of those pills.
hmm
So I think,
I used to put the oven mitts on to give them a pill because I was so
Yeah.
afraid they were going to bite me.
I know.
Well, true.
But I
Yeah.
have to tell you,
You
like,
don't
the
have to
once
be
a
at the
week
business
shot,
end of the cat to give the shot.
that's right. And they can be eating or licking a churro or something. You know
Yeah,
what
you
I'm
just
saying?
distract
While they're
them and
doing
they're
it. But
like, yeah,
I
what
think,
happened? Okay, whatever. Okay.
yeah, yeah, it's really, I feel badly that they weren't, how can I say, at least in Durham, that we didn't pursue that sooner, because I think they do better than dogs on immunotherapy, and also it's easier to give a shot. I'd rather give a shot to a cat than a terrier.
Sure. I agree.
Oh, you know what, Janet? Ask her about the diet that your cats are on.
It's in the
Ah.
trough
No,
right
no, no.
there.
It's because she has allergic men that live
Oh,
with her.
Oh, yeah. I was
I
going to
have a
ask you,
husband
do
and
you
son
guys,
who are
do
allergic to
you,
cats.
in dermatology, do you ever get people asking about cat allergy and what to feed?
No,
Well, I
we
do
don't.
the Purina.
Yeah.
Is it
Yeah,
Purina?
that makes.
The
Is it
It's
clear?
Yeah. Yeah.
fabulous.
Live clear.
Clear,
Live
ever
clear.
clear,
Yeah,
live
I
clear.
worked on that
Live
project
clear.
too at
It's
Purina.
fabulous.
It is, but you know what? I have to say, I recommended to
Uh-oh.
them that they break it down like a fifth grader would understand it. And I had cartoon characters
Yeah.
about Feldy, which
Yes.
is Feldy one, right?
Yeah.
The little guy Feldy, he gets in your backpack,
Yeah.
he gets all over the
Yeah.
place, right?
Yeah.
And then I had his friend Eggy because the antibody is made from
Yeah.
eggs, right? And that, when they joined
Right.
hands, they couldn't get in trouble because, right? So, and I said, you guys are going after MDs that treat cat allergy in humans.
Yeah.
I go, that's ridiculous. They'll just tell them to
Yeah.
euthanize the cat. So, you know
Yeah.
what? They're not going to mess with
Yeah.
food or anything. I said, you need to go direct to the public and you need to make it so
Yep.
easy for the person in PetSmart that's, maybe a high school graduate, luckily if you have one like that, that they can explain it.
I
Well,
don't think
hey,
they marketed it well,
No,
because
they didn't.
I don't think so
when
either.
I first heard it, I thought this is like a miracle.
Mhm.
This should like get
It is a
invention of
They
the
should have put
year.
it in
And
shelters.
now,
They should have put it in shelters. And I have
yes,
talked to our shelter here to get it
Yeah.
into our
I,
shelter
I
so that if it's somebody wants to adopt and they're allergic,
yes,
it
yeah.
Yep.
works.
Her family, her sons and her husband are highly cat allergic, and I got to tell you, it works for her.
They were on
right,
immunotherapy and
right.
they're not
I'm
anymore.
allergic to cats
And
too.
people that come
And
here,
I
see,
went through desensitization.
people come over. Well, and they say, you have cats, I'm allergic. And I'm like, no, no, no. And first of all, they don't
Yeah.
really live in the house. They only sleep here
Yeah, but
and eat
Feldy
and
goes
go
Yeah.
out.
everywhere.
So, but
Remember
that
I said
food,
he attaches to everything?
Yeah.
Yeah.
but that food,
Yeah.
that food's amazing. I think I've been
Mhm.
using it like
So
10
there's no
years.
way that could be on a canned diet, though, right,
No,
Dr.
because
Greco?
it's
It's
a
got to be on a
coating on
dry
the kibble. Yeah. So
coating. Yeah,
you'd have to
that's
eat.
what I thought.
Yeah, right. That's one where you would have to feed dry.
Yeah. So you have to buy the
Well, I'm
hydration
gonna,
stuff, Janet.
Yep, that's it.
Seriously.
well, you know what? I think what I'm going to do is put usually they drink out of the dog's bowl or out of
Yeah.
the toilet. I'm sorry to say, they just
Because
navigate
it's
right to the
fresh
toilet.
water.
They
Yeah,
love the
it's runny.
swirly. I
Yeah.
can't. Yeah, they love the toilet. So they can go upstairs and the dog
Yeah.
can't, so they feel very safe. Plus, I have to tell you, Atticus, the male cat, who's kind of a doof, sorry, he was on top of the outdoor, the grill, which is shiny and water was on it. Honest to God,
Yeah.
hours of
Playing.
Oh, interesting.
on the little flats of water.
That's how they
And
drink
I'm
in the
watching him
wild.
like, oh my
They
God, you big
drink like
nerd.
little
Like,
dew off of
yeah,
dewdrops and stuff like that. Yeah.
he was
Oh, cool.
Uh-huh.
he was having a
Yeah. They
party with
they
them.
don't like big
It was
sources of
really
water
interesting.
because that can be polluted, So they like
Wow.
those little, like the shower, they'll get in the shower
Huh.
and lick the drops off. Yeah.
Yes.
Yes.
Hmm.
Because I see paw prints when
What
they
about, should you elevate water bowls for cats? I've seen some that kind of are tilted,
Yeah,
the food dishes.
that's to help
what?
with what they call whisker stress because you want it to be large enough. Like a friend of mine, she puts these glasses around the house, but she fills the water to the very top, so there's no bending of the whiskers when they. That's called
Oh,
whisker stress.
right.
That's another
Well, what about
thing,
just a big
inhibition of
bowl?
drinking in cats. And then finally, physiologically, they
Huh.
don't get the impetus to drink until their osmolality is up around 350 milliosmoles, where we drink when it's
Uh-huh.
300
Oh,
and dogs. So,
Whoa.
so they're
wow.
just designed to always get their water from their
Huh.
food, essentially.
Wow.
I gotta figure
Yeah.
this one
I
out
mean, when you
somehow.
break it down like that, who ever thought of those things? But it makes perfect sense.
Yeah.
I guess because we model everything after us as humans, because it's all about us,
Yeah,
you know.
that's true. Or our best
Well,
friend, the
this
dog.
has been this is
Oh, yeah,
this has been
that's
so
right.
informative. I'm now I got to change the whole watering
And
system
you
with the
got to buy the
felines.
hydration stuff
Yeah, get
because
the
they're eating the
hydration
live
stuff. That'll
clear.
help. It's a separate bowl. You still have the water bowls, but you put the hydration supplement, and I'll guarantee you your male cat be the one that drinks it the most of it, but he's the one that needs the most.
Look at that.
So it's kind of like what's that stuff you
Yeah,
drink when
it's
you're
like
dehydrated?
Pedialyte
Like
or yeah,
Gatorade
it's
for
kind of
cats.
like that.
Yeah.
But it's not based on
And what's it called?
sodium
What's the
and
name
it's
of it?
not based on sodium and potassium and stuff like that. It's based on these proteins that when the cat takes them in, it draws water in and then they're metabolized and gone. So if you have a cat in heart failure,
Okay.
it's okay, right?
Yeah, got it.
So what's the name of it? Like what do I
Just
search?
search Hydrocare, Hydracare.
Hydrocare.
Oh, Hyperthyroidism.
Care. I don't remember the name
Okay,
of the
I
new
am
one
on
that's
it.
over the
They're gonna have a
counter
new
though,
cocktail.
but they'll be able to tell you if you search that.
Yeah, but if you search for it, Janet, it'll pull it
Uh-huh.
up.
Yeah.
Okay, cool. I'm on it. So we've got to
Yeah.
wrap it up,
Oh, I want to find out
Alice.
what pets do you have, Dr. Greco?
I have two standard poodles and a horse with Lyme disease
Oh,
because I have a similar story to your
Oh.
Lyme disease thing where a veterinarian tried to tell me that my horse had navicular and I said, "You know what? It's a Morgan. That doesn't happen in Morgans. I'll get a second opinion." And I got an internist
yep.
equine vet and she looks at me and she goes, "I think it could be Lyme." And I looked at her and I said, "Horses get Lyme?"
Wow.
Wow, the
So
horse
your
had
standard
it.
poodles, my area of research was sebaceous adenitis.
Oh,
And I love working with standard poodles. We used to have biopsy clinics for standard poodles, and I'd walk into the office and there'd be 30 of them. I was like in standard poodle heaven.
well,
But
yeah.
the problem was I was in my residency, and there I was operating this biopsy clinic, and Dr. Breen had taken the lidocaine with him
Oh no.
to another. He was seeing patients in Louisville. I panicked. There was a dentist office in the next condo. I didn't know them from Adam. I ran over there. I'm a resident. I got to do this biopsy thing. And I think the guy felt so sorry for me. He gave me his big bottle of
Oh,
lidocaine.
that's
So
nice.
saved the day.
Well, I can let him
Yeah.
in if you want.
Yeah, saved the day.
My girl.
Yes,
Yes,
we'd love to
we're
see
here.
them.
Yeah,
Yeah,
we
Yes.
love pet
they'll be
appearances.
happy to
Sure.
come in.
Okay, I found
Come on,
Purina
girl.
Pro Plan, Hydrocare. It says liver flavored supplement.
That's it. That's it.
Okay, we'll try it. They'll drink that right up.
Well, you know what? As long as they're eating dry, you might as well give them the Hydrocare now because you got to do it while they're middle-aged. Oh, look, here
yeah,
they
well,
come.
they're healthy.
Okay, so
Where are they?
Hey, they're coming.
Are they white
these
or
are
black or what?
I have one black and one white. Come on.
Oh.
Oh,
Oh, I
well, hello,
love.
friends.
Okay, this
Oh,
little peanut
I love their grooming.
is from Guide Dogs of the Desert, and they have 60% standard poodles. This is Bo Derek,
Oh, I love that.
and Bo Derek has
Oh.
Addison's disease. That's why she's with me.
Oh, I believe that. Hey, listen, my colleague in Santa Barbara, who's a veterinary dermatologist, sees Bo Derek's pets.
Oh yes, because she lives up there.
So there you go.
Yeah, and
Yeah.
this is
And
Lily.
Who's
she
this?
also sees
That's Lily,
Oh,
and she's
Lily.
I've
Hi,
read
Lil.
Lily. I had her
Uh-huh.
mother, and she's a beautiful
Oh,
black
hi, Lily.
standard poodle.
Who's older?
Lily.
Who's older?
Lily just turned 7. Oh,
Oh,
Derek's not even 2. She's like a year and a
Oh,
half. But when she
you
was,
know, people don't realize what a lovely breed that is,
oh yeah,
standard
yeah,
poodles. They are. And standard poodle owners stand by that breed. They're loyal to that breed.
yeah.
yeah,
I've had,
that's true.
well, I bred 4 litters, and I have out of 20 dogs, I have 8 champions and 2 grand
Oh my
champions.
gosh.
Yeah.
Wow.
So I have some really nice
That's a
stock,
lot of pressure.
but I don't think I'll breed
Wow.
Wow.
I'll
anymore
tell
because
you that,
it's so. But I work with the guide dogs of the
yeah.
desert, and when they need poodle assistance, they have Labradors too.
Oh, I
This
love
is my
that.
second favorite breed. So
Yeah, yeah, yeah. You know, we had on fellow dermatologist, Dr. Emily, and she has a dropout from guide
yeah,
dogs, a lab.
yeah,
Yeah.
it's very
He didn't
common.
quite make it,
Only 50%
right?
make it, and poor Bo Derek, it
Oh,
was because she was diagnosed with Addison's disease. Of course, she couldn't continue in the
oh.
program.
I love her poof,
I
though.
know
She's
she
got
has
a
a
very
great
prominent
poof.
poof.
Yeah.
Well, Dr. Greco, we have to ask, and you kind of answered this already. We ask all our guests, what is your pet or human peeve?
Oh, you're.
Like, what just gets to you?
I call it you can't fix stupid. And it's
Oh,
when, okay, and I'll give you 2 examples of that. One of my clients
okay.
received her insulin and her syringes. She ignored the insulin and decided that the syringes were pre-filled and was giving 3 units of air. And then
Oh my God.
client the
Isn't
other
that a
client
bad thing?
decided when I switched her cat from Glargine to Toujeo insulin, which is much more concentrated, she goes, "Oh, well, I used a U40 syringe to pull it up, 1 unit, which actually the equivalent was 7.5 units because it's U300. As a it's the drug stuff. Like my degree in pharmacology, I use that every single day, and you probably use yours as well, because it's the drugs. They'll mess up the drugs, guaranteed,
Oh my
right?
God. Yeah. I know. You do everything you can. And again, you can't fix stupid. If in pharmacy, I remember, if something's going to go wrong, it's going to go wrong. Remove foil and insert suppository. We had to say that. No,
I know.
remove foil and insert
That's
suppository
what I tell
rectally.
my nurses. I'm like, you know what? You have to go, even though it sounds very rudimentary, and some clients get annoyed. I go, you must do it this way. You must do it this way. You every step. Please write this down. You're
Yeah.
free to
Every
tell
time.
me while I'm speaking. We will give you a sheet of paper that lists everything. Right?
Anyway, we better wind it up. I can't thank you enough. It
We gotta
was
go,
so
but we
great
Yeah, it
lost
was
seeing
really
you.
fun. Uh-huh.
It's a pleasure.
Yeah.
Thank you so much.
Oh, look at
Here's Annie.
how cute.
I don't know.
Annie.
Gidget's up on the bed somewhere.
Oh,
Gidget's a
She's shy.
China
Gidget's
rescue.
shy.
Annie's a former broodmare for the Amish.
Oh.
So we got her out of there,
is
didn't
she
we?
a golden or a Irish setter?
Okay. Yeah. I have 2 Goldens. I know she's like an Irish setter. She wants to be an Irish
Well,
setter.
she's just darker, and
She's
her
darker.
nose
Yeah,
is more
she's
like an
darker.
Irish setter. Yeah.
All right, Janet, we got to
Right.
wind it up. Listen,
All right.
this
thank
is
you.
Dr. Alice Novotny Jeroman and
Janet Novotny King from Cleveland, Ohio, saying thanks for listening. Don't forget to like, share, and follow us. We appreciate you. And if you have any questions, send them in. Thank you so much,
It was
Dr. Greco.
really fun.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's golf ball retrieval service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
Hey, thanks for watching
and listening.
We like likes.
Don't forget to like, share, and subscribe. You can follow us on social media at Speaking of Pets.
and give your pets a big kiss from the Novotny sisters.
The Speaking of Pets podcast is an SLA video production.